Hello and welcome to OT Over Easy. My name is Becca and today we are continuing our talk on wheelchairs. Specifically, today we're going to go over wheelchair measurements, meaning measurements of the wheelchair itself and how to fit it properly, measurements of the environment like hallways and doorways that are needed to accommodate a wheelchair, and ramps. I don't have a wheelchair at home. All I have is my desk chair, so I'm just going to do my best to show examples using my chair, and we're just going to have to use a little bit of imagination. You can do it. I believe in you. So let's crack on. So let's start with measurements of the wheelchair when you are sizing them for a particular client. For the seat width, you want to measure your client at the widest part of their hips or thighs, and then add an inch or two to that. And that is going to allow them to sit in their chair comfortably without rubbing on the sides, as well as any heavy clothing they might wear in a colder weather situation. For the depth of the seat, you want to measure from the back of their butt to the back of their knee, and then subtract 1 or 2 inches, so that when they're sitting in the chair, the seat is not digging into the popliteal fossa. For the height of the seat, first you want to consider the fact that foot plates need to clear the floor by 2 inches. From there, ankles and knees should be 90 degrees and thighs should be parallel to the floor. So the height of your seat needs to be high enough that the patient is in that posture with 90-90-90 hips, knees, ankles, plus the 2 inches off the floor for the foot plates. Make sure you're also taking into account whatever seat cushion they're going to have. So don't measure for the perfect 90-90-90 on a bare wheelchair seat if you're then going to put a 3-inch cushion underneath them, because that's going to throw off your height. The height of the wheelchair back is going to depend on the needs of your client. So it needs to be low enough for the client to be able to function, but high enough to support them adequately. So generally speaking, the lower the back, the more function the person is going to have. So let's say you're measuring a patient with a spinal cord injury who wants a chair that they can play wheelchair basketball in. To maximize their function, you want to make sure the height of the back is lower than the inferior angle of the scapula. Anything higher than that could impede shoulder function. So below the inferior angle of the scapula for maximal function. But if you have a patient, let's say with cerebral palsy, who isn't able to support themselves upright with a back that's that low, they may need a back that is higher, that comes all the way up to their shoulder, and maybe there's a headrest as well. So that's going to depend on your client. Armrests should be at a height that allow the shoulders to be in a nice, relaxed, neutral position with the arms by the side and elbows at 90 degrees. So really, to know if your armrest height is good, just look at your patient. If their shoulders are here, your armrests are too high and they need to lower them. If the armrests are too low, it might encourage more of a slouch forward kind of posture. So you're going to want to raise the armrests a little bit to encourage them to be sitting up more straight. Again, with the arms by the side instead of in front of them like this. So those are the main sizing requirements for the wheelchair itself. Now let's talk about the environment. When getting ready to take an exam on this subject, the golden number is 36. Hallways, 36 inches wide. Walkways, 36 inches wide. Sidewalks, 36 inches wide. Ramps, 36 inches wide. Doorways, 36 inches wide. Now here's the caveat with doorways. You can get away with 32 inches. So if you've seen 32 while you're studying, don't panic, you're not wrong. The reason for that is hallways, pathways, all those are 36 inches to allow space for both the wheelchair and for somebody to walk by the wheelchair. In a doorway, it's not as important for someone to be able to walk by the wheelchair. That's why you can get away with 32 instead of 36. Now a tip for doorways, if you need just an extra inch or two because it's just shy of the 32 inches you need for the wheelchair, a lot of the times an easy and relatively inexpensive fix is to swap out the hinges for offset hinges. And what that'll do is if you look at the standard door, we are losing an inch or two just because part of the door comes over the threshold. But if you have the offset hinges, it'll push the door back. So if you look at it from this angle, it's essentially going to bring the door out and back a little farther so that it's not going over the threshold like that, and that will give you an extra inch or two. So that is just a tip that is going to be much more cost effective than ripping out an entire door frame to widen it that way, if all you need is an extra inch or two to be wide enough for a wheelchair. For a countertop, we're back to our magic 36. Countertops should be 36 inches high. If you're designing a space that a wheelchair needs to be able to turn around in 360 degrees in, the measurements for that is at least a 60 by 60 inch space, or 5 foot by 5 foot. Such a space might be a flat area at the entrance of a doorway at the top of a ramp, so that a client has room to close the door and lock it behind them and then turn around to go down their ramp. So let's talk more about ramp math. The ramp slope ratio is 1 to 12, meaning that for every 1 inch of height you need to raise the ramp by, you need 12 inches of length. So if you need a ramp to go over a 3-inch step at an entryway of a patient's home, that 3-inch step is your height, so 3 inches, so you need 3 times 12 length. So 36 inches of length. Don't forget you need that 5 foot by 5 foot flat space at the top of any ramp. And also sometimes consider you need those 5 foot by 5 foot flat spots in the middle of ramps as rest areas. Let's say, for example, an exam question says the entryway to a home that needs a ramp has 10 3-inch steps. So for the height of that, you just multiply 10 by 3 to get 30. So you have 30 inches of height. To know how long the ramp is, you multiply that by 12. So 30 inches of height times 12 is 360 inches lengthwise. So that's a 30-foot long ramp. But if you think about someone in a wheelchair trying to push up a ramp, certainly some people might be able to do it, but especially if you have a client who lives with fatigue or maybe is an older client, then that's quite a long ramp to try and power up all in one go. So you might want to consider putting a flat 5 by 5 foot space maybe halfway up the ramp to give them a little spot to take a break and have a little rest. So again, know the math, but you also have to think contextually. Is this answer going to actually be helpful for the client? Because sometimes the pure math answer is not the person answer. So just watch out for that. And that's it. As with all of my content, it's not a comprehensive review of every little detail, but I think I have highlighted what I consider to be the most important things you need to know if you're studying for a generalist entry-level exam. As always, I hope this video made studying this content a little more easy. Happy studying! Ramps, 36 inches wide. Woo! We made it.